This is Janet Hill with the Rock Island County Health Department. Thank you for joining us. Sorry for the technical difficulties delay. Today we have with us 3 physicians to talk about the Pfizer availability to people as young as 12. We have Dr. Katz. He's the medical director of the Scott County Health Department. We have Dr. Kandula. She is at Community Healthcare, and Dr. Kukreja at Genesis Health System. First of all, we want to start off with giving you some numbers. In Rock Island County, we have 22 cases for a total of 14,711. There's a little bit of a weird situation today with the data. There are 4 cases that the state just sent to us. So these are not newly infected people. We have 18 newly infected people. And that's not something that we're shocked about. Data is an ever-moving target. So we have 22 cases, 18 are newly infected. And of those 18 people, the average age is 30. And that's very concerning to us. We have 23 in the hospital. And unfortunately, we have the 1 death of a man in his 80s who had been hospitalized. So now we have 319 deaths since the start of the pandemic. As always, we send our condolences to his friends and family. That's all I have. Thank you.
In Scott County, we have a total of 21,424 cases. We have 241 deaths. And then for vaccines given, there have been 141,962 doses of vaccine administered by Scott County vaccine providers. 38% of our total population is currently vaccinated, and 49.4% of our 18+ population is currently vaccinated. As Janet alluded to, this week the Food and Drug Administration and the CDC's Advisory Committee on Immunization Practices recommended expanding the use of Pfizer vaccine to adolescents aged 12 to 15 years. This was based on an in-depth review of data on safety and effectiveness. To further discuss this process and what this means for adolescents in our community, we've invited local physicians to share their expertise and recommendations. Dr. Katz is our medical director of the Scott County Health Department. Dr. Katz, I invite you to take a few moments to discuss the FDA and CDC review process and the basis on which the expansion recommendation was made for this population. Thank you.
Thanks, Brooke. Hello to all the members of the local media. This recommendation for expansion of the EUA comes following review of the results of a blinded placebo-controlled randomized trial that included more than 2,000 adolescents aged 12 to 15 to assess the performance of the mRNA vaccine that Pfizer-BioNTech makes. The FDA has granted emergency use authorization for that new age range, in addition to those 16 and up already authorized. The criteria for granting an EUA, an emergency use authorization, is that, and I quote, the totality of the evidence suggests benefits outweigh harms. So that's the criteria they used. The CDC, on the advice of its Independent Advisory Committee on Immunization Practices, yesterday concurred with the FDA's position. In addition, yesterday, CDC, on the basis of recommendation from the ACIP, has recommended that the prohibition against giving other vaccines at the same time as the COVID jab be removed. The restriction during the clinical trials has been based not on concerns about interference between the vaccines or increases in significant side effects, but this is a standard, highly precautionary recommendation in order to avoid any confusing variables when the clinical trials are analyzed. As we approach the reopening of school, it becomes operationally very critical that our clinics and physicians can in fact not only give COVID vaccines to these kids, but also get them up to date on required vaccines that they need to get back into school. So operationally, that was a big move by CDC that I applaud. Why did they grant the EUA? Well, the FDA scientists and the CDC's independent experts, subject matter experts, reviewed the performance of the vaccine in a trial of over 2,000 adolescents with an average follow-up beyond 2 months from the second dose of vaccine. So these are fully vaccinated kids. The trial demonstrated reactogenicity, that's basically sore arms, fatigue, fever, swollen glands, at rates consistent with, or maybe even a little bit higher than those seen in adults 17 to 25. And that's exactly as expected. There were no severe reactions, and that includes both anaphylaxis and
Dr. Katz, we lost your sound. Dr. Katz? Dr. Katz?
the observed clinical efficacy was like that seen in adults. There were no infections with SARS-CoV-2, the COVID virus, in the vaccine group compared to 16 in the placebo group, beginning at 7 days and later after the second dose in the series. So these results met the pre-specified acceptance criteria that were written into the trial. The kids will be followed for at least 2 years before the trial closes to be sure that any unexpected effects are identified and to estimate the duration that this strong clinical protection lasts, which will be relevant to the need or not for booster doses in the future. Essentially, these adolescents have very active immune systems and they behave very much like those of young adults. These results were exactly as expected. Studies on younger children, 2 to 14, with less mature immune systems are in progress, but I don't expect to see any results from those studies. They're more complicated to do for a number of reasons, probably until late summer or early fall. So that's what I had to say. And Brooke, you want to hold questions till the end?
Yeah, we'll ask some questions of the pediatricians on the call as well. Media can type the questions into the chat and then we'll go to those at the end. Thank you. So thank you for joining us, Dr. Kandula and Dr. Kukreja. We're glad to have you here. We have some questions here that we are going to ask you just to give further information to parents of the adolescents in our community. We can start with you, Dr. Kandula. After the ACIP recommendations, are you recommending your 12 to 15-year-old patients be vaccinated?
Yes, we have started informing parents and patients that Pfizer vaccine has been authorized by FDA, and I've been asking if they have any questions or concerns or would like information about the vaccine. And it is surprising to see that kids are coming forward wanting to know more about it and when they can get it. So yes, we have.
Perfect. And Dr. Kukreja, can you tell us, should parents look at this vaccine differently from some of the other childhood vaccines that they may be bringing their children into the clinic for, such as meningitis or a Tdap vaccine that they could be getting later on? Can you click on mute? I think we have you muted still. Sorry.
Yeah, no problem. I would answer this question twofold, or in two ways or two aspects of looking at this. One regard is that, yes, of course, vaccines, we all understand this was a newer vaccine, and what we all suffered in the last year and a half now, it's been enough. And finally, the product came by Pfizer, and I'm so happy that it's getting rolled on to my population of patients and pediatric population, which I cater to, and happy to give them. And as Dr. Kandula was mentioning, and we are seeing a very fast response. Just I was talking to my front desk, and they were telling that people have been calling and wanting to get the shot as soon as possible when it gets rolled out. And at Genesis, we are looking that we might start giving out some few doses as or Saturday. Goes, yes, vaccine, they're similar in maybe has the protection needed, but we have to see different in comparison to the Tdap or the other necessary adolescent vaccinations, because this is a newer vaccination. Virus has been under control and was a full pandemic, and as we keep on the news, are still some.
Sorry, we're breaking up just a little bit.
Vaccine. I was just trying to say the vaccine population as early as possible. So, and I would have done this at this age.
Okay, we'll try to go to Dr. Kandula. I'm sorry, it's breaking up just a little bit there. Hard to catch that piece. Dr. Kandula, what do you say to parents who might be hesitant at this point or just need a little bit more information about this? What is your message to them at this point?
I would recommend them to have open discussions with their pediatrician about any questions or concerns they have, so that they can get accurate information about the vaccine's safety and efficacy, dosing, and side effects.
And I think we might have Dr. Kukreja still frozen, so I might go to you for another question here. Thank you. Are there any potential side effects that parents should watch for? And are these different from what we were seeing in adults?
So the side effects observed in the vaccine trials for the 12 to 15-year-olds have been found to be very similar to what we have seen in the adults. There have been local reactions were predominantly pain at the injection site, redness, swelling, more prominent after the first dose, and mostly have been mild to moderate. There have been some systemic events, which predominantly included fatigue, headache, chills, muscle pain, as well as fever and joint pains, more prominent after the second dose, and they also have been mild to moderate. No serious adverse events or deaths were reported in the 1,100 patients enrolled in the trials who received the vaccine compared to the placebo group.
Thank you. I think we might have Dr. Kukreja back. We'll try this. If not, we'll go back to Dr. Kandula. But Dr. Kukreja, what do you see as the benefits of vaccination specifically for this 12 to 15-year age group?
So as the schools have been back in person, and we all want to hope that the next school year, we do not have to do online schooling. So my entire motto would be get as the population vaccinated so that they can return to their school. Online schooling has been okay, but as we keep on hearing, even and we have been seeing in our practice patients, and how it has impacted them and their mental health. We have seen a rise in adolescents and teenagers suffering from mental health, sitting at homes, not able to interact with their partners, peers, not able to go into in-school person, having attending classes. That's a must. That's a part of their life. That always has been. And we want to have a happy heart, happy mind to perform better at school. First thing that. Secondly, this population gets covered. It does not transmit the infection then to our more vulnerable patient population, which is grandparents. And that's why even the teenagers are smart enough in today's world to come forward and ask for this vaccination. So it's all a win-win situation to get as much as possible population vaccinated, and then we can achieve our herd immunity, or to get closer to the herd immunity as soon as possible before the virus starts to mutate.
And then to follow up to a question that was on in the media question here, and I'll ask it of each of you three very quickly. Dr. Kukreja, just so that we are very clear to everyone listening, are you recommending your 12 to 15-year-old patients be vaccinated?
Yes, I am.
Okay, Dr. Kandula, can we ask you again, are you asking your 12 to 15-year-old patients to be vaccinated?
Yes, I am, definitely.
And then Dr. Katz, if you were seeing 12 to 15-year-old patients, although you're not currently practicing in that capacity, would you be recommending that parents recommend that their 12 to 15-year-old patients be vaccinated or children be vaccinated?
Yes, yesterday.
Thank you. So there's some common threads there. And then Dr. Kandula, perhaps you can answer this last question on this topic for us. The pandemic we have seen has caused a delay in routine vaccinations. Why is it so important to keep up with routine vaccinations right now?
The routine vaccinations protect children against some serious infections that still exist, although we don't talk about anything else besides COVID lately, but they are definitely out there, and there may have been delays due to avoiding going to their doctor for regular checkups during the pandemic, but it is very important to get those regular health checkups and vaccines on time.
And then just to recap, can you talk, Dr. Kandula, a little bit about the safety? I know that is just the big question when it comes to these new vaccines, and I know we've had a little bit of issues with a couple of the other sounds. The safety of the vaccine for the 12 to 15-year-old population.
So as I mentioned earlier, the trials, there have been more than 2,200 patients included in these trials. Half of them received the vaccine and the other half were in the placebo group. And as I mentioned, the side effects were mild to moderate and no serious adverse effects have been reported, and definitely no deaths have been reported. And looking at the efficacy rates in the vaccine group, so the 1,100 patients who received the vaccine, there have been no reported cases of the COVID-19 infection after the second dose, whereas there were 16 cases reported in the placebo group. So looking at the efficacy compared to the adult trials, this trial shows that it has been 100% effective in this group. And it is very safe. And these trials, just like on the other vaccines, have been conducted in a proper way. Rigorous trials and monitoring has been done, and approval has been done in the right way. So they are definitely safe and 100% effective.
Thank you. Dr. Katz, a couple of public health questions for you, focused. A Harvard Health poll shows difficulty in convincing people to get vaccinated and the declining trust in public health officials. Is this a big concern as you try to convince more people to get vaccinated?
Well, it's always a concern when trust in public health declines. And I think likely that has a lot to do with more than a year's worth of mixed messages coming from Washington. All we can do is cite the evidence and work to regain trust by being transparent and hopefully right at all times. It concerns me, but there's nothing I can do about it that isn't things that I would already do anyway, which is essentially transparency and following the science.
And I know you and I have discussed the CDC's recent announcement saying those who are fully vaccinated don't have to wear masks in those scenarios where they previously had been. Do you anticipate this changing things in our community?
Well, people who want to continue to wear masks can continue to do so. Businesses that are requiring masks on entry, requesting that people wear masks on entry, can continue to do so. If I had a business, I would continue requiring masks simply because I don't know who's been vaccinated and who hasn't. But people will respond as they see fit to this, and I think that's fine. The evidence base upon which CDC made the recommendation is getting pretty firm. There are studies from Israel, the United Kingdom, the United States that have been published in peer-reviewed literature. These aren't preprints that haven't yet been subjected to scrutiny that demonstrate, most importantly, I suppose, that full immunization, that is, last shot of the vaccine that's required plus 14 days, is associated with about 85% decrease in the risk of transmitting if you happen to be a vaccine breakthrough case. So once again, we're talking about harm reduction, but I think that this is a reasonable recommendation from CDC, supported by a fair amount of high quality data.
And this again is focusing on those who are fully vaccinated, correct?
Fully
Not
vaccinated.
the entire population.
It is not the entire population. It's completed the series, whether it's one shot or one of the 2-shot vaccines, plus 14 days to establish the immune response. Those people are considered fully vaccinated, and if they desire, can stop wearing masks, with very few exceptions. That said, in public venues, I think people should continue wearing masks, particularly in crowded situations, until we're in a position, until we've figured out how we're going to know who's vaccinated and who isn't.
There was a second part to that question. Some are saying it could be a HIPAA violation to have to disclose whether or not an individual has been vaccinated. Are you able to share your insight on this?
People don't have to, as far as I'm concerned, don't have to disclose anything. But I would hope that if I ran a business, an indoor business, and put a sign up and said, please mask, the people that didn't want a mask wouldn't come in.
Thank you.
Nothing's perfect.
Yes, I don't see any additional questions. I do believe that Janet had another update from Rock Island County that I'll let her get in here quick before we end our briefing for today.
There was an additional question that was sent to me. Dr. Kandula, have you seen a mental health fatigue among your pediatric patients due to the pandemic, and is it improving?
Yes, definitely. As Dr. Kukreja also mentioned, we have been seeing more and more adolescents and even younger kids complaining about not being able to meet their friends, have play dates like in the past, not being able to meet extended family, not being able to travel, just being home. Even going to school doesn't feel normal like it used to in the past. So definitely we have been seeing a lot of kids coming in with depression and other mental health concerns. And there is hope that it is going to get better. And as I shared in the beginning of the call, that when I was informing my patients about the authorization of the vaccine for the 12 to 15-year-olds, they seemed very excited and were asking me questions: when can they get the vaccine? Where can they go to get the vaccine? And if they can still get the vaccine even though they had the COVID-19 infection. So there's definitely some positive response among the kids.
Thank you for that. I just wanted to add that at the Camden Center mass vaccination site on Friday and Saturday, we will have the Pfizer vaccine and are prepared to vaccinate children 12 and older. Their parent or guardian must come with them though. And then secondly, if anybody is concerned about trying to find a vaccine that is the Pfizer vaccine, you can go to vaccines.gov and do a search for the particular brand of vaccine that you want. Not every provider has every vaccine, but you can search for Pfizer if you are looking for that, or you can search for the other vaccines if you're looking for that also. So thank you.
Looks like there is a question here on Scott County Health Department start vaccinating teens. We do know that a number of our providers have the Pfizer vaccine at this time. And so as they are continuing to vaccinate, we find that there is such a large, excuse me, demand that we need to come in and support that, we will. But at this time, a number of providers between our health systems as well as our pharmacies are fully vaccinated with those types of vaccines, and we'll be doing those. Dr. Katz, do you believe non-vaccinated individuals may go without masks now, and how will that impose a risk to those immunocompromised or children who are unable to be vaccinated yet?
Well, we know that many unimmunized people are going without masks now, and we don't have the authority to issue or enforce mask mandates. Yeah, they pose a danger. Should they become infected, and should they ignore masking and physical distancing recommendations, they pose a threat to people who cannot be immunized or cannot respond optimally to immunization, like large numbers of immunocompromised individuals. So once again, all we can do is appeal to the community to realize this isn't just about each individual's desires. This is about protection of the public health. That is the health of their friends, neighbors, acquaintances, and the people that they may spend time with indoors. I think the safety of not using masks outdoors is much higher, but even there are situations, mainly crowded situations, where masking of people who have not been immunized should continue.
Well, again, thank you to Dr. Kandula with CHC and Dr. Kukreja with Genesis for joining us today. We're very grateful for your information. Dr. Katz as well, thank you for joining us as always. We will put a recording of this on there. Thank you to everyone for staying with us through our technical difficulties. Gotta love that, that we deal with sometimes, but we are grateful for this information. We will be posting it on our website as well as our social media pages. So we invite you to look there for more information. Thank you everyone for joining us. Have a great afternoon and have a nice weekend.
Thank you.
Thank you, you too.